The next system we're going to discuss is the lymphatic system. The lymphatic system is a series of organs, glands, and vessels that filter out the microorganisms as the lymph passes through its various capillaries, vessels, and nodes. The lymphatic system is responsible for the following: cleansing the cellular environment, returning proteins and tissue fluids to the blood, providing a pathway for absorption of fats into the bloodstream, and defending the body against disease. Notice on this slide that you can trace the journey of the lymph from the cells back to the heart. Lymph nodes in the head. You have the buccinators, the infraauricular, the infraparotid, the preauricular, the submandibular, the submaxillary, the submental, the subparotid, and the subrachioid. Okay, with your word parts, you've got bucco is cheek, infra is either under or beneath, pre is in front of or before, sub is under, auriculo is ear, par is near, auto is ear, mandibulo is mandible, maxillo is maxilla, and mento is chin. The lymph nodes in the neck are your cervical, the jugular, the postauricular, occipital, retropharyngeal, supraclavicular, the right jugular trunk, the right lymphatic duct, and the right subclavian trunk. And then you've got your word parts. Cervico is neck, post equals after or behind, auriculo is ear, occipito is occipit, retro is behind, pharyngeo is a pharynx, supra above, claviculo is clavicle, and clavo is also clavicle. The circulatory signs and symptoms. Bradycardia is a slow heartbeat with ventricular contractions less than 60 beats per minute. Tachycardia is a rapid heartbeat of more than 100 beats per minute. So if you look at the slide here, you can see A is normal sinus rhythm, B is bradycardia, which you see how slow the intervals are, and then on C is tachycardia, which is fast. So when you're looking at your word parts, brady is slow and cardia is heart condition. So if you've got a bradycardia, you put those two together, you got bradycardia. Some additional circulatory signs and symptoms. Cardiac murmur. A cardiac murmur is abnormal heart sound heard during systole, diastole, or both, and which may be described as a gentle blowing, fluttering, or humming sound. Cardiac bruit is abnormal sound of the heart on auscultation, which is listening with a stethoscope. It sounds usually like a blowing or swishing sound. Palpitations is pounding or racing of the heart such that the patient is aware of his or her own heartbeat. And don't get confused with palpation and palpitation. Where you got palpation is examined by touch, and then you got your palpitation is a pounding of a racing heart. Some more signs and symptoms. You've got nausea. Nausea is a sensation that accompanies the urge to vomit, but does not always lead to vomiting. Emesis is vomiting, forcible or involuntary or emptying of the stomach through the mouth. Pallor is paleness of the skin and or mucous membranes. Dyspnea. Dyspnea is difficulty and or painful breathing. If it's DOE, that means it's experienced when effort is expended. Orthopnea is difficulty with breathing, relieved only when the patient is in an upright position. Shortness of breath, or SOB, that's breathlessness or air hunger. Pulmonary congestion excessive amount of blood in the pulmonary vessels. It's usually associated with heart failure. And syncope. Syncope is fainting or loss of consciousness. And then you got your word parts. Emesis is to vomit. Dys is difficult. Mnia is breathing. Ortho is straight. Pulmo is lung. And airy is pertaining to. Some additional circulatory signs and symptoms. You got cyanosis. Okay, cyanosis is lack of oxygen in the blood, seen as a bluish or grayish discoloration of skin, nail beds, and or lips. Diaphoresis is the profusion of secretion of sweat. Then you got cardioplegia. So cardioplegia is a heart pain that is best described as atypical or ischemic. Atypical pain is a stabbing or burning pain that is variable in location and intensity and unrelated to exertion. Ischemic pain is pressing, squeezing, or weight-like cardiac pain caused by decrease of blood supply that usually only lasts a minute or so. And if it's specified as precordial pain, that's pain in the area over the heart. And then your word parts. Cyano is blue. Osis is abnormal condition. Cardio equals heart. And algia is pain. So if you put the first one together, cyanosis is abnormal blue condition. Review questions. The term that means profuse sweating is A. Cyanosis, B. Diaphoresis, C. Emesis, or D. Syncope. And your answer would be B. Diaphoresis. Rheumatic fever and hypertensive diseases. Rheumatic heart disease is damage to the heart, most often the valves, as a result of an episode of an inflammatory condition known as rheumatic fever. Then you got hypertension. Hypertension is a systemic, excessive arterial blood pressure that can cause the heart damage if persistent. You will see other descriptive terms include controlled or uncontrolled, whether it is or is not therapeutically corrected. Primary is due to unknown causes, also known as idiopathic. Secondary is due to another disorder. Transient is present for an expected limited amount of time, or with retinopathy, literally the disease of the retina. And then when you look at your word parts, you've got rheumato is watery flow, hyper excessive above, or tension is pressure. So if you look at hypertension, excessive pressure, or hyper above pressure. Ischemic heart disease, angina pectoris. That is paroxysmal chest pain or discomfort occurring when the heart does not receive enough oxygen, and it's usually when the heart is accelerated. Unstable angina is a sudden chest pain that occurs regardless of activity and is indicative of a complete blockage of a coronary artery. Your word parts, pectoro equals chest, and is structure. Acute myocardial infarction, cardiac tissue death that occurs when the coronary arteries are occluded and or blocked by an atheroma, which is a mass of fats or lipids on the wall of an artery, or a blood clot caused by atheroma. Then you got your word parts. You got myocardio is heart muscle, and all equals pertaining to. And did you know research results show that men and women often experience different heart attack symptoms? Although men are more likely to experience crushing pressure or pain, nausea, and or shortness of breath, women may not. Many women report extreme fatigue, weakness, dizziness, and cold sweats, along with shortness of breath. Unfortunately, because most women are unaware of these symptoms that may signal a life-threatening condition, they often delay seeking medical advice. Okay, an aneurysm. An aneurysm is a ballooning of the heart. A mural aneurysm refers to the heart wall, while ventricular aneurysm refers specifically to the lower chambers of the heart. And then you have coronary atherosclerosis. That's accumulation and hardening of plaque in the coronary arteries that eventually can deprive the heart muscle of oxygen, leading to angina. Further description includes the presence or absence of angina and the location of plaque, whether it's in the native or the grafted vessel. Pulmonary heart and circulation and other heart diseases. Pulmonary hypertension is an excessive pulmonary arterial blood pressure. Acute cor pulmonale, that is a sudden right ventricular failure due to chronic pulmonary hypertension. A pulmonary embolism, infarction, is a blockage of one of the pulmonary vessels accompanied by the death of lung tissue. Then you got cardiac tamponade. A cardiac tamponade is the compression of heart due to buildup of fluid in the pericardium. And then heart failure is the inability of the heart muscle to pump blood efficiently so that it becomes overloaded. The heart enlarges with unpumped blood and the lungs fill with fluid. It's previously referred to as congestive heart failure, or CHF. And then you got your word parts. Pulmono is lung, airy is pertaining to, hyper equals excessive, tension equals pressure, core equals heart, cardio is heart, and ac is pertaining to. Mitral stenosis. That is a narrowing of the valve between the left atrium and the left ventricle, caused by adhesions on the leaflets of the valve. It's usually the result of recurrent episodes of rheumatic endocarditis. Left atrial hypertrophy develops and may be followed by the right-sided heart failure and a pulmonary edema, or also known as cor pulmonale. The term mitral is derived from the appearance of the valve and its similarities to a bishop's mitre or hat. Tricuspid stenosis is a relatively uncommon narrowing of the tricuspid valve associated with lesions of other valves caused by rheumatic fever. The symptoms could include jugular vein distension and pulmonary congestion. And then the word part for this page would be stenosis equals narrowing. Mitral valve prolapse is the protrusion of one or both cusps of the mitral valve back into the left atrium during ventricular systole. Then you got your mitral regurgitation. Mitral regurgitation is the backflow of blood from the left ventricle into the left atrium in systole across a diseased valve. It also may be the result of a congenital valve abnormalities, rheumatic fever, or mitral valve prolapse. And on this one, your word part will be pro equals forward and lapse equals fall. Cardiomegaly. Cardiomegaly is the enlargement of the heart. Cardiomyopathy is a disease of the heart muscle, also termed as myocardiopathy. Your word parts, cardio equals heart, megaly is enlargement, cardiomyi is heart muscle, and pathy is disease. Endocarditis. This is an inflammation of the inner lining of the heart, while pericarditis is inflammation of the sac surrounding the heart. And with your word parts for this one, you got endocardio is endocardium, itis is inflammation, and pericardio is the pericardium. A dysrhythmia or an arrhythmia is an abnormal heartbeat. They both mean the same. Flutter is extremely rapid but regular heartbeats. They're usually between 250 to 350 beats per minute. Atrial flutter is extremely rapid but regular atrial rhythm. Fibrillation is extremely rapid and irregular contractions, either 300 to 600 beats per minute, and that occurs with or without an underlying cardiovascular disorder, such as coronary artery disease. Atrial fibrillation is the most common type of cardiac arrhythmias. It is associated with excessive alcohol consumption. Ventricular fibrillation is rapid, irregular contractions that may be fatal unless reversed. Ectopic beats are heartbeats that occur outside of a normal rhythm. Atrial ectopic beats are the irregular contractions of the atria. These are also termed as premature atrial contractions, also known as a PAC. Then your ventricular ectopic beats are irregular contractions of the ventricles. These are also called premature ventricular contractions, or also known as a PVC. These are not always considered pathologic. Your word parts is dys is abnormal, rhythm, O is rhythm, ia is condition, a is either no, not, or without, atrio is atrium, all is pertaining to, ventriculo is ventricle, and R is pertaining to. A heart block. A heart block is the result of a lack of electrical communication between the atria and the ventricles. It is also called atrioventricular block. A bundle branch block is an incomplete electrical conduction in the bundle branches, either are on the left or right side. A sick sinus syndrome, also known as SSS, is an abnormality of the sinus node. It may necessary that the pacemaker of an implantable one. Ventricular tachycardia is a condition of the ventricular contractions that are greater than 100 beats per minute. And your word parts, ventriculo is ventricle, R pertaining to, tachy equals rapid, and cardia is heart condition. The cerebrovascular diseases. A cerebral infarction is tissue death within the brain. It may be the result of a hemorrhage or a blockage, also known as thrombosis or an embolus. These can also be called the cerebrovascular accident or a stroke. The intracerebral hemorrhage is an escape of blood within the tissues of the brain. A subarachnoid hemorrhage is an escape of blood into the cavity between the arachnoid membrane and the pia mater, covering the CNS. Monoplegia is a paralysis of one limb on the left side or right side of the body. The terms are related to the cerebrovascular diseases. The first one is aphasia. Aphasia is the lack or impairment of the ability to form or understand speech. A dysarthria is the difficulty in pronunciation, articulation of speech. Apraxia is an ability to perform purposeful movement, and ataxia is the condition of lack of coordination. And then your word parts. A again equals no, not, or without. Phaso is speech. Ia is condition. Proxo is purposeful movement. And taxo is order or coordination. The diseases of the arteries, arterioles, and the capillaries. An aortic aneurysm is a localized dilation of the aorta caused by congenital or an acquired weakness in the wall of the vessel due to atherosclerosis or hypertension. Arteriosclerosis is diseases in which the arterial walls become thickened and lose their elasticities without the presence of the atheromas. Intermittent claudication is cramp-like pain in the calves resulting in limping caused by poor circulation in the leg muscles. The term intermittent means that the patient experiences it at irregular intervals. Peripheral arterial occlusion is a blockage of blood flow to the extremities. Acute or chronic conditions may be present, but patients with both types of conditions are likely to have underlying atherosclerosis. Occlusion, which means blockage. The peripheral vascular disease, or PVD, is a vascular disorder limited to the extremities, may affect not only the arteries and veins, but also the lymphatics. Raynaud syndrome is the idiopathic disease that is of unknown cause of the peripheral vascular system that causes bilateral intermediate cyanosis and arrhythmia, numbness of the distal ends of the fingers and toes. It occurs almost exclusively in young women. Raynaud's phenomenon is a secondary to rheumatoid arthritis, sclerodermas, or traumas. And vasculitis is the inflammation of blood vessels, also called angiitis. And then you got your word parts. Arterio is artery. Sclerosis is abnormal condition of hardening. Occluso is blockage. Eon is the process of. Vasculo is vessel. Syn equals together. Drome equals run. Itis is inflammation. And gangio is vessel. Diseases of the veins. Esophageal varices is varicose veins that appear at the lower end of the esophagus as a result of portal hypertension. They are superficial and may cause ulcerations and bleeding. Hemorrhoids is a varicose condition of the external or internal the rectal veins that causes painful swelling out of the anus. Thrombophlebitis is inflammation of either the deep veins, also known as deep vein thrombosis, or the superficial veins, also known as superficial vein thrombosis. It's with the formation of one or more blood clots. If no blood clot, it's just termed simply phlebitis. Varicose veins are elongated dilation superficial veins, which incompetent valves that permit reverse blood flow. These veins may appear in various parts of the anatomy, but this particular code for varicose veins has been reserved for those in the lower extremities. Other and unspecified disorders of the circulatory system. The first one is gangrene. That is death of tissue due to lack of blood supply. Hypotension is a condition of below normal blood pressure. Orthostatic hypotension occurs when a patient experiences an episode of low blood pressure upon rising to a standing position. And the idiopathic hypotension has no known cause. Your word parts. Hypo is below or deficient. Tenso is stretching. And eon is the process of. Disease of the lymphatic vessels and lymph nodes. The first one, lymphadenditis, is inflammation of the lymph node. Lymphangiectasia is the superficial dilation of the lymphatic vessels. Lymphadengitis, that stands for the inflammation of lymph vessels. Lymphedema is the accumulation of lymphatic fluid and a result of swelling caused by obstruction, removal, or hypoplasia of a lymph vessel. And then you got splenomegaly, and that's enlargement of the spleen. And then your word parts, a lymphadeno is lymph gland, itis equals inflammation. Lymphangio is lymph vessel. Ectasia, expansion, dilation. Edema equals swelling. Spleno is spleen. And megaly is enlargement. Benign neoplasms of the circulatory system. An atrial is a benign growth usually occurring on the interstitial septum. A hemangioma is a non-cancerous tumor of the blood vessels. It may be congenital or may develop later in life. An thymoma is a non-cancerous tumor of the epithelial origin that's often associated with myasthenia gravis. The cardiac myxosarcoma is a rare cancer of the heart, usually originating in the left atrium. A hemangiosarcoma is a rare cancer of the cells that lines the blood vessels. Terms related to malignant neoplasms. A Hodgkin lymphoma, also termed as Hodgkin's disease. This cancer is diagnosed by the detection of a type of cell specific only to this disorder, the Reed-Steinberg cells. A non-Hodgkin lymphoma is a collection of all other lymphatic cancers but Hodgkin lymphomas. This type is the most numerous of the two lymphomas and is the sixth most common type of cancer in the United States. A malignant thyoma, also termed as thymic carcinoma, this rare malignancy of the thymus gland is particularly invasive and, unlike its benign form, is not associated with the autoimmune disorders. And then your word parts, you got thymo is thymus gland, and oma is tumor. Review questions. Extremely rapid and irregular heartbeats. Is it A, ectopic beats, B, fibrillation, C, a flutter, or D, angina pectoris? And your answer would be B, fibrillation. Next one, inflammation of a vein with formation of a clot is A, varicose veins, B, thrombophlebitis, C, claudication, or D, Raynaud's disease. And the answer here is B, thrombophlebitis. Did you know since 1900, cardiovascular disease has been the #1 killer in the United States every year, except for 1918. Cardiovascular disease claims almost 10,500 more lives each year than the next 6 leading causes of death combined. The circulatory system procedures. These procedures are related to the cardiovascular system and procedures related to the lymphatic system. Your PCS guidelines alert that the coronary arteries are classified as a single body part that is further specified by the number of sites treated, not by the name or number of arteries. Separate body part values are used to specify the number of sites treated when the same procedure is performed on multiple sites in the coronary arteries. Terms related to the laboratory tests. The cardiac enzyme test measures the amount of cardiac enzymes during a myocardial infarction. A CRP, or a C-reactive protein test, is a blood test to determine the degree of inflammation in the body. It's used to predict the risk of heart disease. The homocysteine levels are used to predict the risk of stroke and CAD. A lipid profile measures the lipids, which is your cholesterol and triglycerides, in the blood. Procedures of the great vessels and aorta. An angiocardiography is the injection of a radiopathic substance during cardiac catheterization for the purpose of imaging the heart and related structures. A digital subtraction angiography is the digital imaging process wherein contrast images are used to subtract the non-contrast image by surrounding structures, leaving only a clear image of the blood vessels. An angiotripsy is a crushing of a vessel done to control bleeding. The percutaneous transluminal coronary angioplasty is a surgical procedure in which a catheter is threaded into a coronary artery that is affected by atherosclerotic heart disease. The balloon at the tip of the catheter is inflated and deflated to compress the plaque against the wall of the artery and increase blood flow. Stents, which are wire mesh tubes, are placed in the arteries and used to prop them open after angioplasty. Recent studies have shown that in cases of the in-stent restenosis, a narrowing of the luminal stent. And then you got your word parts. Angio is vessel, tripsy is crushing, and plasty is surgical repair. An aortoplasty is the correction of an aorta, such as repairing an aortic aneurysm. A transmyocardial revascularization is a procedure used to relieve severe angina in a patient who cannot tolerate a CABG or a PTCA. With a laser, a series of holes are made into the heart tissue in the hopes of increasing blood flow by stimulating blood vessels to grow, which is called angiogenesis. And then you have your word parts. Aorta is aorta. Plasty is surgical forming. Trans is through. Myocardio is myocardium. All is pertaining to. Re equals again. Vasculo is vessel. Anization is the process. The procedures of the heart. A cardiac catheterization. A cardiac catheterization is the threading of a catheter, which is a thin tube, into the heart to collect diagnostic information about structures in the heart, the coronaries, and the great vessels. It is also used to aid in the treatment of CAD, congenital abnormalities, and heart failure. A Cardioplegia is an immobilization of the heart in order to perform cardiac surgery. It's also called a systole of the heart. A Cardioversion is changing of an abnormal heart rhythm to a normal one. Then you got your word parts. Cardio is heart, plegia is paralysis, and version is the turning. A coronary artery bypass graft, also known as a CABG. This is a surgery, is an open heart procedure in which a piece of a blood vessel from another location is grafted into one of the coronary arteries to reroute blood around the blockage. A pericardiocentesis is an aspiration of fluid from the pericardium to treat cardiac tamponade. A pericardiolysis is the release of adhesions of the pericardium. A septoplasty is forming a closure of an abnormal opening in an interatrial or intraventricular wall of the heart. A valvuloplasty is the repair of a damaged heart valve. And your word parts. Pericardio is sac, surrounding the heart. Centesis is a surgical puncture. Lysis is releasing, destroying, or breaking down. Septo equals wall or partition. Plasty is surgical forming. Valvulo is a valve, and aorto is the aorta. Cardiac procedures. The left ventricular assist device, the LVAD, is a device that is a mechanical pump device that assists a patient's weakened heart by pulling blood from the left ventricle into the pump and then rejecting it into the aorta. The LVADS may be used on those patients awaiting a transplant. The minimally invasive direct coronary artery bypass, or mid-cab, is a surgical procedure in which the heart is still beating while a minimal incision is made over the blocked coronary artery, and an artery from the chest wall is used as the bypass. Procedures of the heart and great vessels. The electrocardiography, also known as the ECG or EKG, is a recording of electrical impulses of the heart as wave deflections of a needle on an instrumentation called an electrocardiograph. The record or recording is called an electrocardiogram. A Holter monitor is worn by the patient to measure cardiac activity during the ADLs. The echocardiography is use of ultrasonic waves directed through the heart to study the structure and the motion of the heart. The transesophageal echocardiography are images that the heart through a transducer introduced into the esophagus. And then you have your word parts. Electro is electricity. Cardio is heart. Graphy is recording. Echo equals sound. Trans equals through. And esophago is esophagus. A PCS guideline alert. Now with your B44.4, the coronary arteries are classified as a single body part. They are further specified by the number of sites treated, not by the name or number of arteries. Separate body parts values are provided to indicate the number of sites treated when the same procedure is performed on multiple sites in the coronary arteries. Procedures of the arteries and veins. Arteriography is a suture of an artery. An endarterectomy, that is the removal of the atheromatous plaque from the inner lining of an artery. A phlebectomy is the removal of a vein. If termed ambulatory, it is a procedure to remove superficial varicose veins. A plebeiography is a process of X-rays recording a vein after injection of a contrast medium. A phlebotomy is the recutting of a vein for the purpose of collecting blood, also called a venipuncture. A sclerotherapy is intravenous injection of a chemical substance to treat varicose veins, and the venotripsy is a process of crushing a vein to control bleeding. With your word parts, arterio is artery, graphy is suturing, end is within, ectomy is cutting out, phlebo is vein, graphy is recording, tomy is cutting, veno equals vein, and tripsy is crushing. Another PCS guideline alert. Now code B3.5, bypass procedures are coded according to the direction of flow of the contents of a tubular body part. The body part value identifies the origin of the bypass, and the qualifier identifies the destination of the bypass. Note that coronary arteries are coded differently. The body part value identifies the number of coronary artery sites bypassed. The qualifier identifies the origin of the bypass. The B3.6c, if multiple coronary artery sites are bypassed, a separate procedure is coded for each coronary artery site that uses a different device and/or qualifier. The procedures of the lymph glands, spleen, and thymus. The first one, the lymphadenectomies. That is to cut out all or parts of the lymph gland. It's usually performed as part of a treatment for a malignant neoplasm. A lymphangiography, that's the imaging of lymph vessels and glands after the injection of a contrast medium to increase the visibility of the area being studied. It may be done in conjunction with a lymph node biopsy to determine the possible spread of cancer. A splenectomy is to cut out or part of all the spleen to treat splenomegaly or a ruptured spleen. A splenopexy is fixing a spleen that is out of place because of a trauma or congenital condition. And a thymectomy is to cut out or part of the thymus gland to treat cancer or myasthenia gravis. And with your word parts, you got lymphadeno is lymph gland or node. Ectomy is cutting out. Lymphangio is lymph vessel. Graphy is recording. Spleno equals spleen. Pexy is suspension, and thymo equals thymus gland. The suffixes and root operations for the circulatory system. They are as follows. Synthesis is drainage. Ectomy is excision and resection. Lysis is to release. Pexy, repair and reposition. Plasty is dilation, repair, replacement, or supplement. Arrhythmia is to prepare. Tomy is drainage. And tripsy is occlusion. And here's your pharmacology. Angiotensin converting enzyme inhibitors that relaxes the blood vessels by preventing the formation of the vasoconstrictor angiotensin II. The inhibition causes a decrease in water retention and blood pressure and an improvement in cardiac output. The ACA inhibitors are commonly used to treat hypertension and heart failure. Angiotensin II receptor blockers lower blood pressure by inhibiting the vasoconstrictor angiotensin II from binding its action sites. The antiarrhythmic drugs restores normal sinus rhythm via various mechanisms to treat cardiac arrhythmias. The anticoagulants prevents the formation of blood clots. The antihyperlipidemics lower bad and or raise good cholesterol levels to reduce the risk of heart attack or stroke. And then your beta blockers depress the heart rate and forces of the heart contractions by decreasing the effectiveness of the nerve impulses to the cardiovascular system. They typically are prescribed to treat angina pectoris, hypertension, and cardiac arrhythmias. Calcium channel blockers. They decrease myocardial oxygen demand by inhibiting the flow of calcium to smooth muscle cells of the heart, which causes arterial relaxation. The CCBs are used to treat angina, hypertension, and heart failure. Diuretics promote the excretion of sodium and water as urine. They are used in the treatment of hypertension and heart failure. Nitrates or antianginols relax blood vessels and reduce myocardial oxygen consumption to lessen the pain of angina pectoris, also used to treat hypertension and heart failure. And your thrombolytics aid in the dissolution of blood clots. Okay, sort these terms into the correct categories. Your terms are pericardiocentesis, 2, angina pectoris, 3, hemangiomas, 4, atria, and 5, splenopexies. Okay, your categories: anatomy and physiology, the pathology, and procedures. So with A and P, you would put 4, that's an atria. Pathology, which would be angina pectoris and hemangiomas. And a procedure is pericardiocentesis and splenopexy. The takeaways. It is easier to remember the names and locations of the arteries, veins, and lymph nodes if you have a solid knowledge of combining forms from the organization of the body and the musculoskeletal chapters. Medical terminology often includes multiple combining forms for the same structure, such as mirror O, septo, parieto, and diaphragm O, all refer to partitions or walls. We should be studying them together. Practice makes perfect. Use all of your exercises in the text and on Evolve to help you remember these new terms. And this concludes the lecture for the lymphatic system.